Welcome back to the Fresh Freedom Podcast, where we bring you an inside perspective with the freedom-focused representatives who are fighting for our conservative values and defending your constitutional rights. As always, joining me is my good friend Josh Burkeen from Oklahoma. And Josh, so today was a very interesting freshman moment day for me. I was sitting in a room, not too much bigger than this room, at a board table. And on one hand over here, we had Robert Kennedy Jr.
Right.
We had Russ Vought.
Right.
We had Jordan Peterson sitting across from us. In that same room, we had Ted Cruz, Chip Roy. I mean, it was a moment that I had to pinch myself and say, I can't believe I'm here. Did you have the same feeling?
I mean, it was interesting to be in the room with all those individuals. Just having a chance to be so close to RFK, and most people don't realize this, but this guy is not only talking about being healthy, but he lives it. I could not believe how in shape the guy was. You know, what you see on TV and just being close to him, and you can tell the guy works out consistently, and he's a healthcare advocate on many fronts.
Yeah. And so I think it's exciting that the Trump campaign is kind of bringing in his brand, because there is definitely there's some overlap there, right? You've got Robert Kennedy talking about the corruption of the deep state and how it's making our children unhealthy. It's causing all kinds of health problems, and it's all stemmed from allowing all that corruption to occur at whether it's the FDA or the NIH. And so that's kind of in the theme of the Trump MAGA movement is the fact that we have this big swamp that's controlling our lives.
Yeah, and just the discussion today, I mean, just hearing from Callie Means, who's also in the room, and he and his sister are, of course, informing RFK. And so he has, taken on, somebody that is a lawyer that's been in the world of advocating for causes, and then he gets on this healthcare nexus. And then these two individuals, one that was working for a number of companies that were the well-heeled money interest crowd that's got politicians that are heeled to their preferences. Mm-hmm. He was working in that direction. And then in tandem, I guess, with his sister, who was a doctor or on the pathway to become a specialist, who walks away because she's so convicted of what she sees. He's convicted in terms of his heart, in terms of what he's seen on the corporate level. And they join forces, write this book. RFK joins forces with them. And those who have seen Tucker Carlson interview them, and he's constantly saying to them, I think you're going to change the world.
Yeah, I've shared that Tucker Carlson interview again and again.
To hear the stats, I encourage people to go watch the interview. If you just plug into the 19-minute, I think to like the 23-minute mark on that 2-hour interview with both siblings, and it's what you hear RFK talking about extensively. That just the 1 in 1,500, the same sample size that had autism in 1980 compared to now 1 in 36, or in California I think it's 1 in 22 they keep citing. Just this astronomical surge of autism. They're talking about this estrogen loading among young females in our country, and how they are entering puberty on average 6 years earlier than what we were in 1900. The obesity epidemic in our country, where 75% of adults are obese, and 50% of our kids, and then 9 out of 10 of the leading causes of death in this country can be traced to health, a lack of paying attention to what we're consuming and our exercise habits. And so when you tie all that together with 20% of our entire spending on the SNAP program, Supplemental Nutritional Assistance for
needy families.
Thank you. Food stamps, most commonly known for generations. 20% of that total expenditure is going to junk food. 10% of it's going just to what Callie Means talks about. I don't know if he said it in today's meeting, but just what he calls diabetes water. And, you and I got engaged in this with work requirements on the food stamp population,
Right.
and I with Rubio on that bill of Healthy SNAP. There are companies up here who will walk into your office. We had one in our office last year, came in and basically threatened our chief of staff, said, we'll run against you. We will get involved if you pursue this legislation. My chief of staff told me about it yesterday.
Yeah.
He never told me about it. But that's the kind of stuff that provokes you. You go, there is the well-heeled politician up here who is not willing to rock the boat. These companies that receive these massive amount of federal taxpayer allocations, who are protecting their interest, and they don't care the long-term health impacts
Right.
as long as they get on the vaccine schedule or they're a part of SNAP.
Yeah. Wow. Yeah, because it was enlightening me today to learn that there's government employees, there's federal workers that because they are part of the testing of some of these pharmaceuticals or they are then given basically paid $150,000 a year for the rest of their life. But these are government employees.
Yeah, the skewed data. I mean, one of the things that they've been talking about is once you get on the vaccine schedule for the vaccines that are from birth to young adulthood that is most commonly followed, that there's taxpayer subsidization for those vaccine companies. Mm-hmm. And so the most effective lobbyist that you can be up here is to try to get your company mixed in. And that's why if you compare the 1980 schedule compared to what we're giving today, the concoction difference is astronomical. If you want to go in and say, hey, I just want my child to receive the 1980 version, you can't. Because of the real market allocation, no competition, they're bundling these vaccines, and to struggle and piecemeal out the ones that would, does this one lead to death? I mean, that's, for me, my household,
yeah.
Does this one actually lead to death? Why am I vaccinating my child against hepatitis B on the day they're born?
Yeah, one is that one of them, I believe, is a vaccine against an STD, that's is only
the day they're born.
Transmissible
Hepatitis B.
So that is kind of disturbing.
Do you remember that when your children were born? Them asking you specifically?
Oh, yeah.
I don't.
No,
I don't remember.
They didn't ask me. No,
But to find out that your child was given that vaccination against an STD.
I'll tell you
on the day they're born.
That is an interesting memory. My first daughter, they're this beautiful child. They goo and guy at you, and I remember taking her to the doctor's office. They laid her on the table, and they had me hold her head and while they injected, and I remember feeling like so awful at that moment, and so I just as a new dad, it was a tough moment for me, and I have been down this road of researching it more and more, and so
look, I don't remember it. It probably occurred. I probably gave my consent. But for new parents, it's just such a blur. Mm-hmm. But look, what RFK, Callie Means, his sister are bringing up is a place to where intelligent people can have a rational dialogue about is moneyed interest playing a role in using government lobbyist influence to make sure their profit margins and the health of the American people is not really the first priority.
To your point, it would be one thing if we could point to the science and say it's not a problem with vaccines, okay? Because the science has demonstrably proved that it's not. But because the system is so corrupt and there's all these, special interests and influence and funding that's coming from the private sector to fund NIH and to fund FDA, then how can you say the science, how can you rely on the science? So I think the first thing we have to do is eliminate the corruption, then we can know what the real science is. And then start giving people choice and the real information.
Well, to what RFK is talking about, let's say an RFK goes in, he's over, NIH, or he has some, cabinet position where he can heavily influence, and make sure that we let the science speak for itself, that there's not somebody, tipping the scales so that some company benefits as the results. And that's what they're contending. That's what he and Callie and these people that have an extensive resume, they're contending that the scales are being tipped, a predetermined outcome. I'll give you one that's interesting. If you look at USDA quantifying, my chief found this and brought this up in our meeting with Callie that you and I were a part of, chief of staff. He went back and looked at what was the leading element or consumption on SNAP, and they had broken down soda into different liter size or number of can size, 12, 24 pack,
SKUs.
so that when they reported what was the most consumed items, it wouldn't show soda at the top, it would show milk. And if you do it by what's the product, soda, then by volume, it would be number one, but so that USDA could make it look like milk is the most consumed item of all the things that were purchased under SNAP, they purposely deviated those in volume quantity to downplay what we really know is really happening, and that is we're spending way too much money subsidizing.
And whether or not it's good or not, soda, I mean, I drink soda, but the point is that the question is, why are we fudging with the data, and why are we taking taxpayer dollars and dedicating it towards this? So.
Yeah, look, if anybody wants to eat junk food, that's your right.
Mm-hmm.
Question is, does the taxpayer need to be subsidizing it?
Right.
And then we already have the taxpayer subsidizing the healthcare outcome, right, through Medicaid, et cetera. But what an amazing thing we could do if we could have people that were really interested in, look, we want you to have freedom of choice in what you want to consume. But you also are up against a system that is skewing the data, food charts that are produced by the FDA, USDA conglomerate, what they're contending now, that actually show that sugar in the 10% dosage of the diet for a child is something that ought to be advocated from the federal level. And you got people in the room saying, that's ridiculous. Why would we be pushing processed sugar on our children when we know that it has such negative health outcomes?
Well, it's awesome and really refreshing, and it's exciting that this is part of the Trump campaign, and I'm looking forward to seeing the election. I think this is our last week here for another month, and next time we'll see each other is after the election.
Yeah.
We'll know who the next president is going to be, so that will be exciting.
Yeah, and look, I think all of us who came out of that meeting today hoping that there's a place for RFK in a position where he can go in and shake some cages. Rattle some cages. Callie and his sister as well.
It'll be exciting. Thanks for joining us, and thank you for listening and watching. If you found this conversation insightful, show us some love. Hit the like and subscribe button to share it with your friends. You can catch this podcast on Spotify, Apple, YouTube, X, and Rumble. Until next time, stay free.